Good evening, everyone. This is my audience. Hello, gentlemen. I am sure that whenever you hear the word osteoporosis, it is about the subject of male osteoporosis, its effect, and also the silence that has been surrounding this disease. Most of the research data comes from the International Osteoporosis Foundation. I will discuss here with you the evidence of high rates of osteoporosis in men and the fact that it is not talked about enough by healthcare professionals. We will go over the following. I will give you statistics about the incidence rates of osteoporosis in men, presenting key information for you to be able to make informed healthcare decisions. I will give you steps to assist you in making these informed decisions. According to the International Osteoporosis Foundation, the risk of osteoporosis in men over age 50 is greater than prostate cancer, the risk of prostate cancer. Now that is a huge statement in itself, gentlemen, because we hear repeatedly on the TV about prostate cancer and its effect on men. But many clinicians do not counsel or screen men for the risk factors that are associated with osteoporosis. For men and women, bone mass peaks around between ages 25 and 30. Men lose bone mass more slowly than women. Men have two peaks of what we call osteoporotic fractures in a lifetime. The first happens before age 50 and then it peaks again in elderly men. There are also two types of male osteoporosis. Primary osteoporosis is related to aging or to hypogonadism, which is a hormone imbalance. Secondary osteoporosis, which is much more common, is the result of conditions that contribute to accelerated bone loss. How is osteoporosis found or diagnosed? A lot of times, a man will be taken to the emergency room with what is known as a fragility fracture. Or during a doctor's visit, a man may complain of back pain and have an x-ray done, which will reveal vertebral compression fractures. The definitive diagnostic test, or gold standard as it is often referred to, is called dual energy X-ray absorptiometry, or DXA. It is a low-density radiation tool that measures the central bone mineral density of the spine and hip. If these are found to be low, then a man can be said to have osteoporosis. According to both the International Society for Clinical Densitometry, the guidelines for men state that DXA is for men over age 70, men with a history of fragility fractures, and men with risk factors for osteoporosis. However, according to the National Osteoporosis Foundation, DXA is indicated for men who are on long-term glucocorticoid therapy and men with X-ray evidence of osteopenia, which is decreased bone density. I have here a handout for you which goes into much greater detail as to what the risk factors are. And they are divided into two categories: those that are modifiable or can be changed. For instance, calcium deficiency, excessive alcohol intake, and tobacco use. There are non-modifiable risk factors also: being over the age of 70, being of the Caucasian race, taking certain medications, and having a family history of the disease. There are ways to prevent osteoporosis in men. According to a study of 138 men aged 65 or older, they don't have much knowledge about osteoporosis and don't think they are at risk. We must teach male patients how diet, exercise, using alcohol, and tobacco can affect their risk of developing osteoporosis. Diet, changing your diet to include more calcium and vitamin D and you doing exercise will increase your bone mass. Excessive use of alcohol and tobacco can decrease your bone mass. Calcium can be found in Tums, which is an inexpensive supplemental source for calcium. In conclusion, we must inform men about the risks of osteoporosis. We must stop the silence. Nurses can play a significant role in disseminating the information needed to prevent, recognize, and treat male osteoporosis. Osteoporosis is no longer a silent disease for men. Clinicians must talk with men about modifiable and non-modifiable risk factors and help them to understand how important it is to change the behaviors that they can. We must teach men also how to make their homes safer in order to prevent falls that can lead to bone fractures. And because of life expectancy changes, male osteoporosis is expected to become a serious public health issue. The time is now to get the word out to at-risk men. Thank you for your time and attention.